ഇന്നത്തെ കെയർ ആൻഡ് ക്യൂറിൽ നമ്മൾ ഡിസ്കസ് ചെയ്യാൻ പോകുന്ന BPH എന്ന് പറയുന്ന ഒരു അസുഖത്തിനെ കുറിച്ചാണ്. ബിനൈൻ പ്രോസ്റ്റേറ്റിക് ഹൈപ്പർപ്ലാസിയ എന്ന് പറയുന്ന ഒരു അസുഖമാണ്. പേര് കേൾക്കുമ്പോൾ ആരും പേടിക്കേണ്ട. സംഭവം എന്താണെന്ന് വെച്ച് കഴിഞ്ഞാൽ പ്രോസ്റ്റേറ്റ് ഗ്ലാൻസിന്റെ എൻലാർജ്മെന്റ് ഈ ഒരു വിഷയത്തിനെ കുറിച്ചാണ് ഇന്നത്തെ കെയർ ആൻഡ് ക്യൂറിൽ നമ്മൾ ഡിസ്കസ് ചെയ്യുന്നത്. ഇതിനെക്കുറിച്ച് നമുക്ക് പറഞ്ഞു തരുന്ന യൂറോളജിസ്റ്റായ ഡോക്ടർ ശ്രീറാം സാംബരാജു ആണ്. Doctor, welcome to the show.
Thank you so much.
Yeah. Before we discuss about what is BPH and all, what is this prostate gland actually?
Yeah, prostate gland is an accessory sexual organ.
Okay.
So it's a walnut-shaped gland which is located beneath the bladder.
Okay.
So this is the bladder and this is the prostate gland.
Okay.
So it actually this gland is beneath the bladder and surrounds the urethra. It surrounds the urethra. Urethra is the passage through which urine comes out.
Okay.
So this gland usually enlarges after the age of 40 years.
Okay.
So its actual function is it forms the bulk of the semen.
Okay.
That is, it releases the secretions and which nourishes the semen.
Okay.
Yeah.
That is a function.
Yes. Yes.
Gland.
Yes.
So why does it enlarge? What causes the
It's
enlargement?
mainly hormonal. As you know, after the age of 40, the testosterone levels they start declining, and the estrogen levels start increasing. The estrogen, it converts the testosterone into dihydrotestosterone. This is the active metabolite which causes the prostate cells to increase in the number. So this causes the benign prostatic hyperplasia. Yeah.
So exactly in BPH, what is happening in the prostate gland or what is happening in the body of?
Yeah. Prostate gland as such, it contains 70% glandular elements and 30% fibrostromal elements like muscle, capsule, stroma and all. So in this 70%, the glandular element, it starts enlarging in the size. And the number also increases. So suppose any organ in the body, to maintain a perfect homeostasis, the proliferation and then the programmed cell death, they have to happen in this thing. So in BPH, what happens is there is inhibition of the cell death. So there is increased proliferation and these keep on increasing in number. They form nodules and these nodules, they merge to form enlarged prostate gland.
So normally at what age?
It starts after the age of 40 in all men, and around 50% of men over the age of 50 years, they have BPH, and 80% over the age of 80 years have BPH.
Is there any situation where this BPH develops below 40 or for young men?
Not such. Actually, it starts from the age of 40. Yeah.
And what are the causes?
As I said, the hormonal factors and then the growth factors which are produced, and then imbalance between the cell proliferation and cell death. So these are the causes for BPH.
And what are the risk factors?
All men develop BPH, but not all develop symptoms. And the size of the prostate is not related to the symptom. So some patients have a smaller prostate, but they have more symptoms. Some patients have a large prostate, but they have less symptoms. So,
but what I mean to ask was like if we diagnose a person with BPH,
Yes.
What is it causing to his body as a result of BPH?
Symptoms. He develops some symptoms called lower urinary tract symptoms.
Okay.
So these symptoms might be obstructive or voiding symptoms or irritative or storage symptoms.
Okay.
So because of the obstruction, the bladder needs to work harder to expel the urine.
Okay.
So obstructive symptoms like hesitancy, like when he goes to the washroom, it doesn't immediately start the act of urination. It takes some time.
Okay.
And there is intermittency, like it is not a continuous stream. So the stream stops, starts, stops, starts.
Okay.
And there's a poor flow, poor stream of the urine. And also there is straining. Because there is some obstruction, bladder is not able to empty effectively. He uses his abdominal muscle. He strains to pass urine.
Okay.
So these are basically the obstructive voiding symptoms. And then coming to the irritative voiding symptoms, he will have increased frequency, like he needs to go at every half an hour or every 1 hour. And he needs to get up more than thrice at nights after sleeping. Usually people get up only once, at the most once.
Yes.
So if he has to go more than 3 times, then that is called nocturia. Then the other symptom is urgency, like he cannot control the urge. He has to rush to the washroom, and before reaching the washroom, he might leak few drops of urine as well. So these are basically the 2 symptoms, like obstructive or irritative voiding symptom. Yeah.
So basically the problem is coming with urinary tract infections they develop.
Yes, because the complete urine is not being emptied because of the enlarged gland. So some amount of urine remains after passing urine. So this acts as a nidus for the infection, and these patients develop recurrent urinary tract infection. Yeah.
As you mentioned before, the main role of this is to nourish the semen.
Yes, yes.
So coming to that part, does this affect any kind of reproductive problems?
No, it doesn't as such affect any reproductive problem. It doesn't have any effect on the reproductive function.
Okay.
But the medicines which are used to treat the prostate might cause like retrograde ejaculation, like ejaculation might not come out. So these are the side effects of the medicine which are used to treat the BPH. Yeah.
So how do you diagnose
So
BPH?
clinical examination, when a patient walks in, we just ask him the symptoms and we just note down the symptoms and then examine the abdomen. We see whether the bladder is palpable or not. Usually it should not be palpable.
Okay.
And then we do a digital rectal examination to feel for the prostate and to know the nodularity and to know the consistency of the prostate. And then we order, and then there is a symptom score like International Prostate Symptom Score.
Okay.
So 7 symptoms are there. Each symptom is graded from 0 to 5 based on the severity. And based on the score which a patient gets, they are classified as mild, moderate, severe. So 0 to 7 score is classified as mild, 8 to 19 moderate, more than 20 is severe.
Can you list down those 7 symptoms?
Same like I told, obstructive and irritative, like hesitancy, intermittency, poor stream, straining, frequency, urgency, nocturia. And there is an additional factor which is called quality of life. So we take detailed history regarding the quality of life, how the BPH is affecting the quality of life of the patient. And the treatment depends on the quality of life and bother. So if they are more bothered about the symptoms, then we start treatment. It's like that, yeah.
And when we talk about this enlargement, how is the presentation like? It will be like quite big, or the patient can feel it or something big inside?
No, he
Nothing
just
like
has the symptoms, and based on the examination, it starts as grade 1, grade 2, grade 3. So normal size is around, normal weight is around 20 grams. So it increases. Some patients might have up to 30, 35, 40, 50. So that we can know on the ultrasound of the abdomen. We know the exact size of the prostate. Yeah.
What is the extreme situation, or what is the fatal? There will be an extreme situation for this.
Some patients, because of the increased hyperplasia, some cells they develop dysplasia and it might lead to prostate cancer. But not in all patients. Suppose if you take 100 patients of BPH, around 5%, 10% they develop prostate cancer. And that too with advancing age. So after the age of 60, so what we advise is regular annual examination to rule out early prostate cancer. Yeah.
So when prostate cancer is unfortunately for somebody, what is the treatment? Is it curable or is it a dead?
It depends on the stage. As such, there's a blood test called PSA, prostate specific antigen. So it should be ideally less than 4 nanograms per ml. So if it is increasing based on the level of increase, and then we advise a biopsy, which is taken from the transrectally. And that biopsy will give us the grading of the prostate, and based on that. As such, prostate is a very slow growing cancer. So no one dies with a prostate cancer. They usually die with other diseases like MI, other things, but people usually never die of prostate cancer. Yeah.
So are there any glands or any enlarged glands which are not cancers?
It's not like cancerous condition. Prostate also might develop infective conditions like acute prostatitis or chronic prostatitis. These are the infective conditions. So in these, they have, in addition to these symptoms, they have the burning sensation while passing urine. And they have fever. And they have persistent pain in the lower abdomen perineal region. So in that way, we classify them as prostatitis or BPH.
So these are the classic symptoms of a urinary tract infection as such.
Yes.
So coming part, the treatment part of this BPH, how the treatment?
As I told you, initially we take IPSS scoring and then we grade the patients as mild, moderate to severe. So mild patients, we usually advise them to adopt some lifestyle changes like fluid restriction before 9 in the night if they are having too much nocturia. So they have to restrict the fluid before 9. And then we advise not to take too much of caffeine or alcohol because these cause the bladder to get irritated, and then the symptoms increase. So these are the lifestyle changes. And even with this, the patient is having similar bother and all, we start a medication. So there are 2 kinds of medication. One is which reduces the pressure of urine flow. So there is increased pressure here. So that pressure we relax. This is alpha adrenergic receptor blockers, they are called. So they release the pressure so that the patient is able to empty the urine completely. And other medication is, it reduces the size of the prostate. Those are 5-alpha reductase inhibitors. So those we advise in patients who are having more than 30 grams enlarged prostate. So below 30, we just give alpha blockers. Above 30, we give a combination of both. and the size reduces to almost 20 to 30% by 6 months. So it needs to be taken for a longer period of time so that the size also reduces. Yeah.
Is there any situation where any surgical procedures are required to treat this?
Yeah. So patients not improving on medical management, we again follow up with IPSS score. If the score is not decreasing, or the score is increasing. So those patients we advise surgery. And those patients who develop complications like recurrent urinary tract infections, or some patients because of the residual urine, they may develop a stone in the bladder. So that we treat both prostate and stone simultaneously. Yeah.
So apart from the medications and all, what we can, like home remedy, is there anything we can do?
Home remedy is what we say is vitamin D is essential for the nutrition of the prostate. So vitamin D plays a role, and then tomatoes contains lycopene, selenium, zinc. These all have a nutritive value on the prostate. So they are good for the prostate health as such.
So when you say some foods are good, definitely there will be some foods that are villain for this.
And it's not actually dependent on the diet. Only the prostate health is maintained by zinc, selenium and all. There's no particular food which will cause prostate enlargement because it is a natural process.
Okay.
All the men after the age of 40 develop BPH.
Okay.
But
that's
only,
for sure.
yeah, sure. Okay. But only some people will develop the symptoms. Like if you take 100 patients, around 40 will develop symptoms, 60, they just get on with it. Okay. It's like a natural history of a male.
Okay.
Yeah.
So by modification of lifestyle as such, what all changes we need to do?
As I told you, fluid restriction. We have to restrict fluid by 9 p.m. in the night.
Okay.
And then try to take as much as fruits, vegetables in the diet. Okay. And then keep your sugars under control. Some people, diabetic people, they have increased risk of complications.
Yeah.
Because already there is residual urine and there's increased chance of urinary tract infection. So we advise them to keep the sugar levels under check.
Okay.
Yeah.
We always hear that this prostate problem is always there for the people who are diabetic. So what is that connection and how these diabetic people have to manage?
Yeah, diabetic people, as I told you, they have increased risk of urinary tract infection. And because of prostate enlargement, they already have residual urine. Okay. So this acts as a nidus for infection. Okay. So they need to keep the sugars under check so that the risk of recurrent infections comes down drastically. Okay. Because recurrent infections again is an indication to go ahead for the surgery.
Okay, but is there anything like diabetes is a cause for this?
No. Diabetes is not a cause. But only it just complicates the already natural process.
Okay. Yeah. Okay. So what are the other things we have to take care, or what are the other risks related to this? Anything other than what we discussed?
There are no particular risks. As I told you, it's a natural history of a male. He always every male after the age of 40, he develops an enlargement of the. Yeah.
And coming to other urology problems like kidney stone or something like that. So, is there any connection like people with kidney stone will develop this, or vice versa? Or vice versa is there always?
Vice versa is there. Because of the prostate, he might develop a bladder stone. Okay. But not all patients with kidney stones, they don't necessarily develop prostate enlargement.
Okay. Now coming to this kidney stones, that is another great problem affecting both ladies and gents.
Yes.
So what all precautions we need to take care to avoid that?
Main thing is water intake. At least we advise everyone to take at least 3 liters water a day. Okay. Because as you know, when you take a glass of water, mix some salt in it. Okay. To a certain extent, the salt will dissolve. Yes. But after that, it starts to precipitate. Yes. When you add more water, this salt also will dissolve. In the same way, if you intake a lot of water, at least 3 liters, that will drastically reduce the chance of crystal formation. Okay. So in all patients, small crystals form. They usually pass out in the urine. Okay. So some people who do not take enough water, these crystals, they aggregate and they form a stone. Oh. Yeah.
So then people with the history of uric acid, they are more prone to developing this kind of stones.
As you asked me before, diet plays a significant role for patients with stones, not for the prostate. Okay. So stones is high uric acid containing foods like beef, mutton, fish. These have a lot of uric acid. So we advise them to cut down on them.
So what are other things we have to take care to avoid stones as both ladies and gents?
Yeah, there is a fad that increased intake of milk and dairy products causes stone. Yes. But it is not true. Okay. Milk, calcium, everything is important, especially for postmenopausal women. Okay. The only thing is we should not add extra salt in the diet. So salt should be limited to around 5 grams a day, not more than that. So increased salt, it causes increased excretion of calcium. And this causes the stone. The calcium, uric acid, they combine to form the uric acid or calcium oxalate stones. Okay.
And then coming to this urinary tract infections, most of our viewers are mothers, and they will be having this problem with kids because they tend to hold urine for a long time. So what all we have to take care in kids to avoid UTI?
In the kids?
Yeah, in the kids, yes.
Yeah, kids, they should be encouraged to pass urine whenever they have an urge, whenever they feel. Some kids, they just postpone urination in the school. They keep waiting for 2 to 3 hours.
Yes.
We should advise the parents or the teachers, like allow them to go to the washroom every hour or every hour and a half so that they empty the bladders and then the chance will come down drastically.
Okay. Yeah. And coming to the urinary tract infections in ladies, so what all we have to take care and how that?
Yeah, compared to males, ladies are at more risk of developing UTIs because the thing is, ladies are having only a short urethra. Yeah. It's only around 4 centimeters. Okay. On the other hand, males have a long urethra, so it's very difficult for the organism to gain access into the bladder. Okay. So the thing is, main water intake, if you take enough water intake, whatever organisms they gain access, they are flushed out in the urine. And then we advise the women not to hold urine for longer times. Like whenever they have an urge, go and just evacuate the urine. Okay. Yeah.
So other like urinary infections, when we develop urinary infections, what are the other complications generally ladies face?
Recurrent UTIs, like they keep getting urinary tract infections every 15 days, every 1 month. So this urinary tract infection, if it is confined to the bladder, it's fine. But if it goes upper tracts into the kidneys, that will lead to a more serious condition like pyelonephritis. Okay. So that is a life-threatening problem.
Okay. And coming to renal failures.
Yes.
So can you tell us about the renal failures?
Renal failures also, they are classified according to the types like pre-renal, renal and post-renal. Pre-renal mainly is dehydration. So suppose there's not enough water and all. Pre-renal causes. Renal causes are the cause in the kidney as such, nephrons. There is interstitial nephritis or any medication which we take like painkillers. These have an effect on the nephrons and the tubules as well, like Voltaren. So we suggest them to take only paracetamol, not more than that for the pain relief. Post-renal is stones obstructing the ureter. When a stone is stuck in the ureter, the kidney tries to flush out the stone, but ultimately it gets failure and develops renal failure. Yeah.
Then people with diabetes, they are more prone to renal failures. Yes. So can you please describe about the connection of diabetes and renal failure?
The same way I told, they are prone to more risk of UTIs. Same reason, because of if the people retain urine for longer times, that will give a chance for the organisms to grow. And these have high glucose contents in the blood and all in the urine. All the tissue fluids, they have high glucose content, which are conducive for the urinary tract infections to develop. Yeah.
Now coming back to this treatment of stones. What are the modern treatments available now?
Modern treatments, initially when a patient comes with a stone, suppose we diagnose a stone in the ureter. If it is less than 5 mm, we usually wait for 2 weeks. So usually, it's a body's natural, this thing is to flush out the stone. Less than 6 mm stones, they'll be flushed out in around 2 weeks' time. After that, if the stone is not coming out, then we go ahead with the endoscopic treatments like ureterorhinoscopic. We go through the urethra into the bladder and into the ureter, and then break the stone with the laser energy.
So there is no invasion?
No, drastically after the development of this endoscopic technology, the drastically open surgeries have come down. Yes.
So this, so by this particular procedure, the stone itself is damaged inside the kidney itself, it's damaged. So how is it passed out by urine?
Small fragments. As I told you, less than 6 mm stones, they are passed out. So we fragment the stone to less than 3 mm or 2 mm, and then we put in a stent, which will allow the fragments to pass out. The stent is removed after 3 weeks' time.
That's great. Then we have a perception that this gallbladder stone is something related to kidney stone, but I believe both are different.
Both are different.
What is the difference, basic difference between this?
Both are different, but the thing is they have a common metabolic problem. See, suppose a patient is having metabolic problem in the blood, like increased uric acid, increased calcium, and then increased phosphates. So they might have a tendency to develop both gallbladder as well as renal stones. So in any patient, usually when we diagnose a gallstone, we usually routinely check for the kidneys as well. Just to rule out a renal stone.
So this gallbladder stone is the same reason.
It's formed, but more it contains of the biliary calculi and the biliary elements and the biliary oxalates. Same thing.
Same.
Yeah.
So, to wind up, what all we should be taking care to avoid any kind of renal problems? What is the basic, or in a nutshell, what is the advice
Yeah,
that you
main
have
thing
to
is
give?
water. So especially in this hot climate,
Yes.
so especially we all are in the AC
Yes.
environment, so we don't feel the need to take more water.
Yes, exactly.
But we need to take at least a glass of water every hour, so that it accounts to around 3 liters per day. So
Okay.
that is the main thing. So always I advise my patients to take enough water.
That is the only key to
Yes,
have a
yes.
healthy kidney
Yes,
as such.
yes.
And any other food habits that that is bad to kidney?
Food habits, as I told, stones and all, like high protein containing
Okay.
foods like beef, mutton, fish, they have high uric acid content, so they might lead to stone formation. So usually we advise them not to stop, but at least to reduce the frequency, like weekly once or twice a week, like that.
How about this cold, this soft drinks, carbonated
Soft drinks also, we advise them to cut down. Alcohol, soft drinks, smoking. Smoking particularly because it irritates, causes bladder cancer.
Okay.
So smoking has a strong risk for bladder cancer as well as renal cancer. So we strongly advise the males to stop smoking. Yeah.
That's something great. Okay, anyway, Doctor, thank you so much
Yeah,
for your
thank you
time.
so
It
much
was
for inviting.
really informative.
Yeah, thank you so much.
ഇതോടുകൂടി നമ്മുടെ കെയർ ആൻഡ് ക്യൂർ സെഗ്മെന്റ് ഇവിടെ പൂർണ്ണമാകും.